Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and in today's video, I am here with a woman named Alma. Alma, I think you live in California, is that correct?
That's correct.
Awesome, right? So I'm in Pennsylvania, and Alma is a member of our Glute Relief Accelerator program, and I'm just so grateful to have her here to share her success and her story because I know it's going to inspire a lot of people who have tried lots of different things. I actually was just reviewing your case review before we chatted, Alma, and like in the last line, right? Is there anything else you'd like to share? And it was like, you are my last hope. Right. And so
Yep.
if you're watching this and you've tried lots of different things, been told you have lots of different things wrong with you, then you're going to get some value and to pull some nuggets from Alma's story and know that chances are you can heal naturally. That is what we do. We work with people all around the world with back, butt, sciatica problems. It's our exclusive specialty. And our goal is to teach you how to use the power of your mind and movement as medicine. And that's what we did for Alma. And she just totally knocked it out of the park and is back to doing things like playing tennis and other things. So let's start with this, right? So for anybody watching this, it's good to start with like, hey, what are some different things that you were told was wrong with you? So how long were you in pain? And then what were some different like diagnostic labels or explanations for why you hurt? Can we just kind of go through that to paint a picture of what you were dealing with there?
I was hurt for, I want to say over a year. So it was an on and off things. And every time when my sciatica came out, it would probably last like a couple months. And the
Mhm.
last episode I have, which started on October, and it lasts for about, I want to say October, November, December, January, February, March, until March,
Okay.
basically.
6-ish months or so.
Yeah.
Yeah.
So,
Yeah.
yeah. So every time when I have pain, I went and see a doctor. The doctor will tell me, go do this stretch and go do that stretch. And the stretching program changes constantly based on where I tell where my pain is. And then my family doctor will tell me, go take this painkiller. And if it's not enough, then up yourself and take another kind of a painkiller and so forth. So that was my life for, I want to say for a long period of time until to the point that I feel like, I really don't want to live on the bottle and another bottle of the painkiller.
Yeah.
And neither do I want to continue doing stretching exercise, which I don't know whether it really help or because is it because it held naturally or it does real help the exercise really helped me to, overcome my problem. So then one day I was try to be a doctor myself, go on to YouTube, and then I found this ad from Dr. Charlie saying that, you download this video, then you can try to diagnose yourself and see what you have and whatnot. So I did that. I spent an hour watching that video, and I feel like this makes so much sense. So then I got really interested to find out more. Then I started following Dr. Charlie. Then eventually I told myself, I'm gonna join the program and see how it goes. I mean, what do I have to lose at that point, really? And everything else doesn't seem to help other than, continue taking painkiller and go and see the PT that really doesn't help me in any way. So then that's the reason I joined. And I
Awesome.
believe I was in the program for about 6 weeks and not even 6 weeks. The first week I see like great improvement on myself.
Yep.
And then another improvement was somewhere around 3 weeks and then 6 weeks. And then now I think I'm in the week 12 or 13 or 14. I don't really have I don't have sciatica anymore. I just want
Yeah.
to tell you this. Not
Yeah.
I'm back to my normal life.
Yeah.
I can play tennis, I can do weightlifting, I can sit, I can drive, I can do whatever I want, but just be more careful. That's all.
Yep. Got it. Cool, cool. All right. So that's a big, broad picture there, right? And you notice you mentioned a couple key things that I want to highlight for folks who are watching, right? So you mentioned that you were kind of, and not even you, but like the providers that you were seeing were sort of chasing this pain. So you would get one label. I think, for example, you were told at one point you had a pinched nerve, right? Then you threw
Mhm.
around this sciatica, which is kind of similar but a little bit different. Then at one point, right now, you had X-rays and CT,
Yeah.
whatever. Bursitis, that was another thing. Probably,
Yes.
probably piriformis came up somewhere in there,
Yes.
right? Anything else
Yes.
that came up?
That's pretty much it.
Mhm.
Oh yeah, so then I did went and based on what you just said, yes, those are all the history, my medical history during that period of time. So I end up seeing a hip specialist,
Yeah, yeah.
but I never really got to just get a chance to see a spine specialist because I refused to do the MRI. which
Yep.
I totally agree with you. I think going to do an MRI only just reconfirm you have a problem.
Yep.
And then you're gonna put yourself into the process of having a surgery, which is not something I want to do.
Yep.
So
Yeah.
that's the thing. So yes, everything you mentioned was correct. That was everything I got labeled throughout the period of time. And that's why when I send you that email, I really feel like, I think I'm really sick based on what they tell me. So I need to find somebody that I feel like he can help me. And that's
Yep.
why I say you're my last hope.
Yeah, yeah, totally. And we see that so commonly, right? People get an MRI thinking that it'll lead to, right, a better diagnosis or a treatment, a better mousetrap, right? But it's kind of just that. It's sort of a trap. So you get to the end of the yellow brick road and it's like, okay, well, I just paid all this money for this picture. Now what do I do? And it's like,
Right,
oh, well, pills, shots, surgery, whatever, right? And you're like, well, I
right.
don't want any of those things anyway, so why did I need that, right? Now, there are obviously times for it, right? But this is why I provide my DIY diagnostic guide, because I highlight, hey, if you have these different flags, right,
Hmm.
then yeah, we can go that way. But for most people, many people above the age of 20, which probably most people watching this will
Hmm.
have some type of degeneration or, I don't know, tendonitis or something, right, in their spine, in their
Hmm.
hips. And they probably don't hurt because of it. So there's this balance here, right? So you got these different diagnoses. You got this hip bursitis thing. You go see this hip specialist, and they probably tell you to do hip bursitis stretches, right?
Yes.
Then you probably go down the hip bursitis route. Then you go down the sciatica route, right? The PT is
Hmm.
trying to then treat the pinched nerve.
Hmm.
Share with us if you can, right? What was different about the process and program that we took? Did we treat a specific diagnosis and put you in a box? Did we provide a little bit of a different foundation for you to approach treatment? Kind of how would you sort of state what that looked like?
I think the treatment I got from the my previous PT and the specialist and the doctor is more or less like they see the symptoms and they want to make sure that the symptoms is go away. Their
Mhm.
ultimate goal, basically, what they told me is that they want me to be able to move on with the daily life. But so that means that any symptoms that you got is preventing you to perform your daily life activity. They need to try to get rid of it. Doesn't
Yeah.
matter what it is. So that's what they do. But as far as the treatment I receive from you, it's more or less like, well, don't worry about the symptoms that you're having right now. Think about, what we can, think outside of the symptoms and think about things that you want to do and then what you can do, and rather than worry about why is this sentence that is preventing you to perform kind of things.
Yep.
So that's how I feel the difference. And
Yep.
then the other difference is that because they only basically chase, like what you say, they're chasing the symptoms. So there is really no scientific, way that you can understand why they do what they do. But the way you put things together is more like, like remember the flow chart you created.
Yep.
So, this is the reason, this is possibly the reason causing this. And then you go back to what is the reason, what was the main cause of causing, how should I say it? You,
Yeah.
you know the cause of the symptoms, but then you go back to visit, like everything to do with your daily activity, your normal behavior and how your mind operate, those things that combine together to figure out that what really causing that initial problem and then try to solve it at that level. That's what I see the difference.
Yep. Yeah. What I say is the difference to try to explain it to people is like, hey, you can try to treat the medical diagnosis, right? But it's
Hmm.
really hard, by the way, when using the mind and movement, which is the two things that we
Right.
synthesize together in the program. It's really hard. Like, imagine if you did have let's just say we'll label it as okay, pinched nerve, right?
Hmm.
And I don't know, it's at the L4, L5, or the L5
Yeah.
or S1, whatever, right? If I were to say to you, hey, we're going to do this motion and we're going to target just that area, right?
Hmm.
I just want you to unpinch that nerve. I don't want you to move anything else. Don't move your hip. Don't move your piriformis. Don't move your disc. Don't move anything. Just wiggle that nerve. You'd be
Hmm.
like, what? That's hard to do naturally. If you're getting shots, if you're getting surgery, they can be very specific about what they're doing. But our kind of idea is, look, movement is an input. It's non-specific, right? The
Hmm.
mind is the CEO. The body is the instrument of the mind. So we have to understand both. And by
Hmm.
the way, instead of just treating this diagnosis, this picture, you're not your picture, you have this pain experience and it's made up of both this body and brain type of thing. So
Right.
when
Exactly.
you hurt yourself, right, you move less. And what
Hmm.
does that tell your brain? Movement is bad, right? You were told, for
Yeah.
example, like, don't do that. don't play tennis, don't play that, don't do
Right.
this, don't do that.
Yeah.
The less you do that, the more fearful you become. The more fearful you
Right.
become, the less you move, the less you move. And you see this negative loop. And so we want to treat brain and body and teach you to do detective work so that you can identify in your daily life
Hmm.
what things are triggering the symptoms and how you could change that.
Hmm.
How that specific pain is showing up in the movements that you perform so that you can try to also improve those in a very, like you said, systematic, scientific way.
Right.
Nice, nice. Now, you also mentioned something else. We didn't change symptoms anymore. We brought it down to like a root source, okay?
Hmm.
And then you said, "Hey, well, I had nothing to lose, Charlie, so I joined your program because I was tired of doing things that I wasn't even sure if it was working. Was it just time, or was it these exercises, or was it this treatment?" So how did you know if what we were doing was working? How do we teach you how to tell?
So I gotta say that the things that really I realized how I learned was that the first time when you joined the program, I think in one of your video you say that don't do anything that you used to do. Just
Yeah.
take a whole week break. And
Hmm.
that it would, if nothing improve, then that means whatever you've been spending time doing doesn't help.
Yeah, it was a
But
waste.
yeah, it's a waste of time.
Yeah.
So I was a little, scared to follow that because I was like, oh my God, because I was stretching like almost every couple hours and I feel good about it.
Yeah,
So
yeah.
it's like telling me to, to let go of my babysit kind of thing. It's a little tough. But then I figure, you know what? I already joined a program. I wanna see. So if I'm in pain, then if I'm in pain, So I did that.
Yep.
And that week basically told me everything I used to do is a waste of time, completely waste of time.
Yep.
That's the I mean, I want to actually say I probably feel slightly better at the end of the week by
Yep.
doing nothing
Hmm.
versus doing everything that they told me to do.
Yep. Yeah. So we look at things very scientifically. And I say, look, I'm not saying, Alma, that you can't do all those things you want, or that they might not even be helpful, or they may not be helpful, right?
Right,
But at the end of the day, there's only three responses to any input: same, better, or worse. And if you
right.
remove something, and that old quote, the love quote, right? If you love someone and you let them go and it was meant to be, they'll come back to you, right? If
Right.
you let something go
Uh-huh.
and right, you actually were getting value from that thing, then what you'll see in your metrics, because we teach you how to
Mhm,
track progress, right, is that
mhm.
you'll see, wow, I'm getting worse. So something you were doing was making you better. Now we need to figure out exactly what that was, the one or two things. Okay, you removed elements and you calmed muddy waters. And what you found was that I'm no better, maybe slightly, but I'm definitely no worse. And so, oh my gosh, was that I was doing all that stuff and maybe I didn't need to, right?
Yeah.
Right. Or you could feel better, and then we know that something you were doing was actually keeping you from healing. So we start off very scientifically, and then we actually provide you with a private healing log, and you just record some scores. And
Mhm.
do you think that that was valuable? And if so, in what way?
The healing log?
Yeah, where you can
Yes,
track
I think
progress.
so because one, I think, if you I think it's a very good method that you actually keep documenting your pain pattern, so to
Yeah.
speak.
Yeah. Yeah.
So every week you revisit like, okay, where is my pain? And then you can actually see that, one thing for my, taking myself as example, I actually can see my pain pattern was jumping everywhere.
Mhm.
So that's kind of odd. I mean, if I really have some kind of a structural issue with either my spine or my muscle or whatever that is,
Yep.
then the pain should be consistently happening at the same spot. But in
Ah,
my case, it was like jumping left and right, from the left side to the right side, to the hips, to the knee, and to whatever that is. So that kind of, the log will kind of tell you, whether, in my opinion, after going through your program, then I
yep.
realized that this log is the fact of telling me that, you might not really have a physical injury that you think you have. You
Yep.
might have what you have is what it's in here.
Yep.
You think you have a pain, but you really don't have a pain. So
Yeah.
that
Yeah.
will tell you what kind of a pain situation you are in. But then again, if my log actually show that I constantly having a pain in my back, then yeah, that's probably telling me that you do have an issue in your back. And then,
Yep.
then you can figure out what to do to help to make your back feel better, kind of
Good,
thing.
good. Yeah, very cool. So you pulled two things from the log. It's like a two-tone benefit from the log. So number one, all pain is real, and we recognize that, but there's two drivers of pain. Most people
Mhm.
relate, and you did this on your case review. You put what I call perceived injury. Well, it must have been tennis, right? But
Yeah.
can you actually recall the moment in time when you were playing tennis and you hurt yourself? Well, not really, but it must have been tennis, right? So we all go back to that very like physical origin of symptoms. That's how we're kind of biologically wired to just like, I hurt, there's got to be something physically damaged, right?
Hmm.
But also the brain can actually learn to experience pain and live in a heightened state, right? Which can actually create very physical symptoms. It doesn't mean it's not real. It just means that maybe treating the physical body only isn't going to be the best way to solve the problem. And so
Hmm.
the value for anybody watching this, as you, if you want to come up with your own tracker, awesome. But we provide what we call a private healing log. And we have a system where we track 6 numbers, right? We can take the summation of those things and make decisions based off of not the emotion of I'm in pain and I feel a little insane and it's sunny and it's cloudy or whatever, but okay, no, actually every week my numbers are either going in the right direction or not. So we can use it to track progress and see if what we're doing is working, or if we need to change it, right?
Hmm.
So we make logical decisions based off data versus the emotion, and
Hmm.
all the fluffy feelings and stuff like that come up. And then also, um, the second thing you pulled from it is that if there are inconsistencies in the data points, a lot of people see it as confusion. Nothing makes sense. I can't find motions that always make me better or worse or whatever. This won't work for me. That's very common. About 50% of the people we work with have symptoms that kind of bounce around and nobody can really figure it out. Hence why the hip doctor, it's a hip problem, the back doctor, it's a back problem, the PT. And so there's no real agreement upon the source. And you're right. That is a sign and a clue or a piece of evidence, right? That things aren't really matching up. Why are they not matching up? Oh, that's really frustrating. Wait, that's just feedback, Alma, that tells you, ding, 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 that maybe your body is not as structurally broken as you've been led to believe. Maybe it's not a pinched nerve. Maybe it's this. And then, right, that
Hmm.
obviously informs treatment and we can start to tweak what we're doing.
Yeah.
Really cool. Good
Yeah.
work. Put that together. Okay. So that is the value of tracking things. You see inconsistencies, and just because data is inconsistent, it's data, it's objective, right? And if you can stay objective, you can start to look at the patterns, like you said, pain patterns. We have found 4 pain patterns that people fall into, right? And they might shift and things might move around, but you can use those patterns to then start to get closer to the truth. Awesome. Now that being said, right? What would you say was like the most valuable thing that you got out of a program as a whole? So you've already talked about little pieces of value here and there, right? What would you say is one of like the most valuable things that you got?
I want to say the understanding of how to manage the pain is the value that I got out of this program.
Mhm.
So in the way that, I feel like the program has this phase 1 and 2 and 3 and 4 that
Yep.
you set it up. I spent a lot of time going through phase 1 and 2, and I went back over and over again because I was, when I first go through it, I feel like I'm kind of confused. I don't really understand this concept. But
Yep.
then when I went over again, over and over again, then I realized that, the key, that was the fundamental of how you're going to overcome your problem. It's like training and teaching yourself how to identify different kind of a pain and how to deal with it, through your
Yep.
head.
Yep. Yep.
And
Yep.
not just like focusing on the pain that you're suffering and try to get rid of it, because fundamentally everything is coming from here.
Yep.
So that was the portion that I think I get out of it. So I was like, it's this tiny little soreness in my back. I'll be like, oh my God, my back hurts.
Yep.
And
Yep.
then that probably kind of in the way train my brain saying that, okay, anytime there's a soreness here, a itchiness there, the way, let's just all classify that as a pain in the back. So that was what happened. But then now I can, and fortunately now I finally can, that I can see, okay, this is a soreness, and I believe is because I've been, doing certain movement too often yesterday. This is just the itchiness in my butt, so let's just scratch it and be over and done with. And this is something that I feel really it's a pain, and that maybe I should monitor and figure out what's going on before I jump to the conclusion. So that pain management is something that I learn and benefit the most
Mhm.
out of it, which is, I want to say, is the element that none of the doctor, specialists, or the PT out there actually are providing.
Yeah.
So they have, I mean, sure, eventually at the end of this program, you will identify the pain pattern for us, and then you will teach us like which stretching exercise that you need to do. Yes,
Mhm.
that's that, but that's not the ultimate goal. I think the ultimate goal is that you have to train yourself to understand your body a little bit better, manage your mind a little bit better. So then with the technique we learn, then you can overcome the problem that you're having. That's
Yep,
what I
yep.
think
Awesome.
is
And
the most
you're just
important.
not managing at this point. You're pain free.
I am pain free.
Good,
Can
good.
you believe it?
Very cool. I know you were in a deep, dark spot when we started, so that is awesome.
Yes.
So the goal is, yeah, not just to manage symptoms, but cure them, right? And give you everything you need to solve the problem. And so here's a really cool point that I just want to highlight. You mentioned something that most people would think is a little bit crazy, not in the woo-woo sense, but in the sense of, Charlie, I want a stretch. Just tell me the exercise to do. That's what I think I need. I know my hips are this. I know my core is that. People tend to know a lot of things, right? And
Yeah.
so coming into the program, then they come into the program and they're like, oh, wow, I just don't know what I don't know, is usually what people say. And so we didn't start with a stretch, right? And let me ask you this. How many stretches or exercises did you do? Did I say, hey, here's 5 things to do. We're going to do your core and your hamstrings and your nerve glides. What did that look like? Because I'm getting the sense it was a little bit different. So share for folks what that was like.
Like how many stretch I do
Yeah.
based on what
In the program. Yeah. What you, based off what you learned. What,
I want to say that when I started, I only actually do one stretch,
yeah.
which is the first one that show on my program. And
Yeah.
it works.
Yeah.
And
Good,
I
good.
didn't even have to tweak it. So I was like, okay, wow, okay, I'm just gonna do this like for, whenever I have problem.
Good, good. Well, and the reason I bring that up is because a lot of people find that hard to believe. How can I possibly? I've tried everything. I've looked all on the internet. I've seen all the exercise, Charlie. You're telling me that like one exercise could be like all I have to do?
It
Yeah,
is.
yeah,
It is just one.
yeah.
And I think the reason why it was just one is because before it was like if you didn't what I'm saying, if you didn't participate in this particular program, in your mind there's all kinds of different pain that's going on. So
Mhm.
that's why you want to try different stretches
Yep,
to get rid of different kind of pain. But
yep,
then if you before you even go there, you sit there and tell yourself, okay, I have 10 different kind of pain on my body. Let's identify all this 10 and figure out like what are they? Are they truly a pain? And
hmm,
then you eliminate those. Maybe it's just gonna come down to be maybe 3 pain or
yeah,
2
yeah,
pain. Then you do the stretch that you tell us to do. Then you're like, okay, this stretch really work because it's meant for this particular pain.
yep,
And everything
yeah.
else that happened, it's once you don't pay attention, it's probably gonna be gone anyway. But I know when I say this, people don't believe it, but that is really true.
Yeah. So, well, that's why I have people like you share this, right? Because they won't believe me. Either way. So, look, the really kind of neat point about that is you're right. Many people come into the program with, well, I was told I have an SI joint problem and a hip problem and an IT band problem. I know you were, right? And a
Mhm,
pinched nerve problem and a calf problem and my ankle. You had pain around your ankle, even your groin. So now it's a hip problem again. And
mhm,
I had all these different aches and pains. And so Charlie, like, I just want the hip bursitis exercises. Oh, and then I need one for my SI joint. And if that doesn't work, then I go to my, it's like, hey, folks, look, is it possible? What are the chances that you have a hip bursitis problem, an IT band problem, an SI joint problem, a spinal problem, and that you're just falling apart? Probably not
mhm.
very high, right? So
Yes.
instead, is it possible that there's one origin of almost all of these symptoms, and you just need to treat that one thing if you can figure out how to reduce everything to that, right?
Yeah.
And that is where we start doing detective work. And so, really, what you're saying is, yeah, the reason why people think they need to do that is because they've been told they need to do that, they have all these things wrong with them. So, well, surely if I have a hip problem, I got to do this hip exercise. And oh, the exercise would change if I have an SI joint problem, but we're not treating the diagnosis. We're treating
Mhm,
your pain experience and how it's showing up for you. And then
mhm,
how do you come to one thing is working? Well, we identify your pain pattern. I've got all this stuff going on. Okay, there's only 4 buckets based off of X, Y, and Z, your story, where you hurt, the different movements that make you feel
mhm,
better and worse, and all the clues. And then, wow, okay, I'm here. All right. And now I know what I'm feeling and why I'm feeling it. And oh, by the way, when I test instead of just guess, I can identify immediately that this one thing works. Holy
mhm,
smokes. So we really try to do like a less is more approach, right? You kind of drink through the fire hose to begin with. You have all these data points, and then we start to funnel it down so that over time you spend less time doing exercise instead of the opposite approach, which is we'll start with these 2 things, Alma. And guess
mhm.
what? When they don't work, we'll add 2 more. And when they don't
Right.
work, we'll add 2 more. And you end up spending more time with less
Mhm.
results.
Right. That is true. Before I met you, my stretching activity takes up to an hour. Can you believe it? It's
Hmm.
like it's like a long laundry list of the stretching activity I have to do. by the time I finish all my stretching activity, I think I'm more exhausted than anything else.
Yeah,
And then
yeah.
you repeat it again. But then after I joined the program, when the time I finally get to do the stretching activity, it's just one. And that's it.
Oh man. So yes, if you're scientific and if you're systematic, you can identify one or two things that really work. Now, obviously it's within the context, right? So we don't start with motion. We start with optimizing the healing environment mentally and physically. You cannot exercise a bad diet, meaning you do all those stretches, but mentally or physically, you're nicking the scab or keeping yourself from getting better for whatever reason, keeping yourself in a fight or flight state is not going to work.
Mhm.
Then, without measuring something, if you don't step on a scale, how can you tell if you're losing weight or not? Well, you could say, oh, my pants are, but you're still using some measurement device there to go
True.
back to say it's working or it's not. Then we
Mhm.
cut out all the fat and the things that don't work. We find
Mhm.
all the things that feel safe and good. We plug them into a process and boom, now you go from
Mhm.
doing 1 hour of exercises a day to, I don't know, 1 minute or something, or for
Right?
a few minutes.
Yeah.
And it works and you know it works
Yes.
and you're not just guessing.
Yes.
Amazing. All right, so where are you at now? So you're playing tennis. I know this is your big goal. So are you doing everything you want to do? Just kind of
Mhm.
share like a quick update as far as where things are at, from not being able to do much at all to now where are you at?
Right now, I'm pretty much back to normal. So because I played tennis when I was in college, so I went back to pick up my habits. So I was really happy about this. So I'm playing tennis now during my, off hours, off work time. And then I also actually joined the gym. So I was doing some kind of a weightlifting
Mhm.
training a little bit because I figure that, it's good to keep my muscles strong also. So,
Mhm.
but I'm being very careful about what I'm doing versus before I'm just gonna go do it and then I hurt. So
Yeah.
now I'm very careful, make sure the technique, everything's correct.
Mhm.
And other than that, I went back to jogging. It was impossible for me to even, I mean, walking 1 block, that was my maximum before. But now I went back to, I was able to jog. And then I also was able to go on for a very long shopping spree, like a couple hours walking in the shopping center without any pain. So that was another good things I like to do. So there is really no limitation at all now in my life. And I was also able to drive to work because before I was unable to drive, period.
Yeah, yeah.
Um,
And when you say that was a benefit too, a lot of people are sort of, well, hey, you can't see me in person, so how can you assess me, Charlie? Right? I find that most people doing a virtual program saves the pain in the butt that they get from having to drive to the place to not really be taught what to do. To then maybe the
mhm,
treatment works temporarily, and then they've got to drive back, and then the problem is back, right?
mhm.
So what to anybody who's kind of saying, hey, well, I need that in-person experience because somebody's got to assess me. Someone's got to put their hands on me. What are your thoughts about that now after going through the process?
Well, at the very beginning, I have that thought too. I was like, well, I'm joining this program and I'm reading this literature and watching this video. I'm not seeing a doctor. Is this really going to help? But again, I really think, the key of this program is to learn how to manage your pain. You don't really need a doctor sitting next to you and say, let me teach you how to manage your pain. You are your own doctor in that point, in that essence that you gotta understand and learn how to be able to manage this issue yourself. So once you understand this concept and understand that you're the person really in charge of making these things go away, then you don't really necessarily care much about whether you have a physical, an in-person meeting with the doctor. Because
Mhm.
to be honest with you, when I was joining this program, I still have my PT section ongoing with my doctor
Yeah,
because he ordered me to do.
yeah,
I cut it down to like once a month, and eventually I just completely drop it because I feel like, well, I mean, I just don't see the points of going to there to see a doctor and all he cares is like, okay, what's your pain? Okay, on your butt, on your back, on your leg, and then okay, here's the exercise per now, go home and do it. Versus you actually try to understand things through the video you provide, and then you kind of test it the way you want us to test it, and then you realize that how to control this and manage this and make this issue go away.
yeah.
I mean, if it's hard to describe this, the benefit, because I'm sure a lot of people will have doubts in there. But once you're in the position where you actually have a chance to do the program online and try to understand the program, and then actually and keep your doctor appointment and see the doctor and have these two options put in front of you happening concurrently, you will see the benefit. You will immediately do like what I do, just ditch that doctor appointment to the side and just focus on the program because you know that's the right things to do.
Yeah, yeah. Well, look, I used to, I taught at USC on
Mhm.
the West Coast there, and very hands-on, right? So I taught DOs and PTs in chiros, right? Hands-on treatment. So I was very used to treating people in person with my hands. I have to feel, I have to touch, all that stuff, right? And then I realized, well, hey, it works pretty good for people in the moment, but people don't know how to fix themselves. And so, what if I could just teach people what I know, right, and the principles and the
Mhm.
concepts, and guess what? They do way better than when I was seeing them in person. All right.
Great.
And so that's the idea. So look, amazing story. And I appreciate you sharing. So you took, we'll say roughly a year of symptoms, kind of up and down all over the place to a point where sitting, driving, working, walking, right? All super yuck. To a place now where you can pretty much go back to doing your little college tennis stuff and your jogging, whatever, back to the gym. Awesome. One of my goals is really to make sure that people are self-sustainable. So not only is this a short-term thing, right? Hey, we want to get you out of pain, of course, right? But I like to think of things a little bit longer
Mhm.
term. Hey, Alma, at the end of the day, yes, we're going to get you out of pain. You got out of pain within 6 weeks, 8 weeks, and now you're further, but you're back to full speed. And then from there, do you feel like we were successful in teaching you the concepts and the principles such that God forbid something creeps up in the future? We're all humans here. The biggest predictor of future injury is previous injury. So you might hurt something else, right, in your body. Do you feel like we've given you the tools to do that, and you feel confident applying these concepts?
Yeah, I think so.
Yeah.
Because, like now I'm back to normal life. And don't get me wrong, sometimes I do have, once in a while, I do have a little back pain here and there. And it does help me, like, instead of sitting there freaking out thinking like, okay, let's call the doctor now and then do this. And if, yeah, or let's go reach out the medical cabinet and get to painkiller and hopefully it will go away. It kind of, the program kind of teach me to, tell myself that, you need to go back to that. Don't do anything and evaluate the situation for a day or two. Then you start, testing yourself and see, is this really a true pain or not? If it's really a pain, then, you have that motion that you can use to test it and see whether it fall into any category. And if it does fall under, then you know what to do because
Yeah.
everything's been spelling out for you. So it's really, I think the thing is that really understand this whole concept, then you can reuse this tool that we learn in this program over and over again. So
Yeah.
I think, yes, I'm pretty confident I will be okay.
Cool, cool. And here's the cool thing. Even if you have questions, we never take away access to anything.
Mhm.
I don't really believe in that. So I want to be here to mentor you for the future. God forbid something pops up, you have access to everything. So just know I want to see you continue to succeed. Okay.
Thank you.
Yeah, no problem at all. And then final thing to wrap this up, right? Many people chat with us. Hey, I've got to think about it. I don't know. And usually it's I'm not sure this will work for me, right? Because they've tried everything. What would you say to someone who's sort of on the fence, right? I've tried lots of stuff. It hasn't really worked. What would you say?
I will tell that person that you don't have anything to lose. You already spent all the money on all these other medical treatment. And what's the difference of, adding another one? Give it a try. And if it doesn't work, then it doesn't work. But I can guarantee you it will work.
Nice, nice. Cool. All right. Well, hey, Alma, appreciate it. Okay. And look, you're totally crushing it. I'm so glad you're back to tennis. I know that was a big thing because it's like, hey, am I ever gonna be able to play tennis again? Right. That was
Yes,
a love of your life. So we got you back to that. I'm sure there's a couple other things, right, that we can tweak moving forward. But if you need anything, let us know. And thank you so much for sharing your story. Okay.
no problem. Thanks,
Awesome.
Dr. Charlie.
No problem. Yep, absolutely. And by the way, like if you're like Alma, all right, and maybe you don't love tennis, but maybe you play pickleball or you have something in life, that you're really striving for and you want to stay as active as possible for as long as possible, and you're kind of a little bit beat down by spending a lot of time and energy and money working with other people who are kind of just generalists, throwing a bunch of different exercises, opinions, diagnoses at you, and you're tired of chasing down that path, then we would love to see if we can help. Now, I can't guarantee that I can help you because I don't know who you are watching this video, but as a part of the process, what we ask is that you apply. So you can click the link below, apply to work with us to see if we can help, and then follow instructions to submit a case review. So I mentioned this earlier. I reviewed Alma's case again before chatting with her today. It's basically a detailed questionnaire. Take 20 minutes or so to fill that out. Gives me all the details that I need to confirm if slash how we can help, as we review thousands of these a year. And we don't know everything, but as a specialist and somebody who only treats these problems, we get a good idea of if we can help. If we can't help, we'll obviously provide alternative recommendations. But that would be the first step. If you're interested in taking a different path and want to learn how to solve your problem naturally, go ahead, click the link below and follow instructions to submit your case review, just like Alma did. So, Alma, that's all I got. Thank you so much. And we'll be in touch. Don't hesitate to reach out and we'll help you out. Okay.
Thank you.
No problem. Chat soon. All right. See you.
Okay. Bye.
Bye. See you.